Hi guys, welcome back to another video of Eduate channel. Today we will be discussing about diagnostic flowchart in canine leptospirosis. So please subscribe and hit the bell icon for more. Step 1 will be clinical suspicion. So the animal will be presented to us with the following clinical signs. So whenever there is an acute illness with fever, often vomiting, lethargy, polyuria, polydipsia, or in the face of oliguria or anuria, plus icterus and a previous history of exposure to rodents or rodent urine or standing water or stagnant water. So the minimum database in all these cases, the first of all, we should get a CBC, serum biochemistry, and a urine analysis. So these are the basic minimum databases that should be with us whenever we are going to make a diagnosis or to put the leptospirosis into the differential diagnosis list. Step 3 will be mainly evaluating the laboratory patterns. So first of all, we will be going ahead with CBC findings. So in almost all leptospiro cases, there will be initial neutrophilic leukocytosis and thrombocytopenia and also mild anemia. So the thrombocytopenia and the neutrophilic left shift will be much more in the amplitude than the anemia. In case of the biochemistry, we will be having elevated bund and creatinine levels. So in the initial stages, where the leptospiremia stages, the hepatic values, the ALT, the ALP, all those values will be initially high because of the acute hepatic congestion and hepatic congestion induced necrosis and the hepatopathy. There will be slight hyperphosphatemia in the later stages because of the reduced glomerular filtration and of the AKI. And hyponatremia, hypochloremia, these are actually not very commonly evident in case of leptospira. But in case of leptospira, elevated ALT, ALP, and bilirubin levels will be in the initial leptospiremia hepatic stage. So the ALT elevation, actually, why the ALT elevation means mainly we have four answers. Actually, because of the direct liver cell damage. Secondly, the immune-mediated hepatitis. Third will be the disruption of hepatic microvasculature due to the leptospiral organism. And also, fourth one will be the concurrent cholestasis because of the bile duct obstruction. And ALT significance in leptospirosis is actually a sensitive indicator of hepatocellular leakage because ALT is an enzyme which comes to the serum, which comes to the plasma when there is an acute hepatocellular leakage. Its elevation reflects active liver damage, but not necessarily a liver failure. So ALT level which returns into normal as hepatic inflammation resolves with the treatment. So the phosphorus elevation is mainly because of reduced renal excretion, tissue breakdown due to secondary factors because the phosphorus inside the cell will be coming out to the general pooling and also because of metabolic acidosis. So the other lab findings in canine leptospirosis will be elevated blood and creatinine levels and bilirubin levels and also GGT levels. So the next one will be urine analysis. Isostenuria, proteinuria will be there because of the AKI and glucosuria may or may not be there and also granular CAS will be there because of the tubular necrosis, acute tubular necrosis. And if all these laboratory pattern matches and clinical suspicion is there, we can at least assume that is an leptospirosis case and start supportively the therapy and use barrier nursing. So in the early infection cases, PCR of the whole blood, that is in the first 7 to 10 days, PCR because of the hepatic congestion and leptospiremia stage, PCR of the whole blood will be positive. And in the later stage, where there is a leptospiruria stage, which can lead to AKI also, urine PCR would be much better. And the gold standard test will be microscopic agglutination test. Four-fold rise in the paired serum samples will be 2 to 4 weeks apart, or single high titer can also be conclusive. Repeat CBC biochemistry every 24 to 48 hours. Monitor urine output. Why? Because in the AKI, there will be severe anuric stage that can lead to severe hyperkalemia and adjust treatment as per response. And we should always inform the owners about the zoonotic risk. Thank you.